Hello and welcome to another lecture. Now we're going to talk about this intracranial circulation, and just pay attention how this works. Remember, as I said in my previous lecture, we have this posterior circulation, which is formed by the vertebral arteries, and then they form the basilar. And then we have this anterior circulation, which is going to give you you have the common carotid, which is going to give you the internal carotid and the external carotid. So the internal carotid is just going to go into the the cranium. It's going to go to the base of the brain, and it's going to join the posterior circulation through a circle. And this is very smart, because this is a way for the brain to keep the circulation at all times, and we're going to study in the future the different type of collaterals that we may have, and we need to know when the flow moves towards the transducer or away from the probe. And in order to understand that, of course, we need to understand the anatomy first. All right, take a look to this picture here. Okay, this one is this is the internal carotid, and then the internal carotid, once becomes intracranial, it's going to give you this, this curve in here, this loop, all right, that we call the carotid siphon. That's a siphon, all right, carotid siphon. And taking off from this carotid siphon, we have, all right, we have this ophthalmic, all right, which is going to go towards the eye. All right, so internal carotid becomes intracranial. We have the siphon, and then taking off from the siphon, we have this ophthalmic artery, right, the ophthalmic, which is going to go towards the eye. All right, and when you do an ultrasound of the eye, so you tell the patient to close the eye and place the probe right here in the front. Then use your color flow, and then you see this artery behind the eyeball, which is this one right here. And then you get a pulse wave signal. You find this waveform, which is moving towards the probe. It makes sense. The flow is going towards the eye, it's going towards the probe. And remember what I said before, we have this facial artery, which is, branch of the external carotid. And if the patient has, let's say, one occlusion at this level right here, the facial, which is coming this way, will connect to all these branches in here, and it will send the flow in an opposite direction, all right, towards the internal carotid, all right, in order to keep the flow going to the brain. So this is what we call one external to internal collateral, and this is why it's so important to understand this anatomy. Okay, let's move to something that we call the circle of Willis. This is beautiful. This is so beautiful. This is a circle that we have in the base of our brain that makes the posterior circulation and the anterior circulation to join together, and then keeping the flow in all regions of the brain at all times. That's amazing. So right here I have a nice representation of the circle of Willis, but I'm just going to do it my way, all right? And then later I'm going to show you this one here as well. But I basically would love to explain this my way, and then we're going to take a look to this beautiful picture. Okay, for that one, we'll open one whiteboard. All right, let's go and open one whiteboard right here. And then follow me. All right, so remember, We have this internal carotid artery, you know, going this way. Internal carotid artery going this way, all right? It's coming from, it's coming from inferior, and this is the end of the internal carotid artery, so this is the end. We're going to call it number 1. So we're going to go here, we're going to say, well, this is the internal carotid artery terminal, all right? This is going to be number 1 right here. And of course, we have one in the right, and then we have one in the left. So once the internal carotid artery ends, we'll give you one lateral branch, this one right here. So we're going to call it number 2. That will be the middle cerebral artery, which is coming from this terminal ICA. And then this terminal ICA also is going to give you this branch going towards the front. That will be number 3. That we call the anterior cerebral artery. Perfect, right? So we have the terminal ICA, we have the middle cerebral, and then we have the anterior cerebral. Perfect, beautiful. So that's for the anterior circulation. But remember, coming posteriorly, we have this 2 vessels in here. Those are the vertebrals, right? And they join to form this basilar artery, right? So we're going to call this one number 4 right here. Number 4, that will be the vertebral arteries, right? And number 5 right here, we're going to have the basilar. Alright, so this basilar is going to give you these 2 branches, one to the right and one to the left. So this way. And how would you call this ones? If this was right here are anterior cerebral, this number 6 will be posterior cerebral artery, right? And then right there we have what? We have the posterior circulation. Now you have the anterior circulation. Now you have the posterior circulation. What's your next step? You have to make a connection from one hemisphere of the brain to the other, and from the posterior circulation to the anterior circulation. Or you may say from the anterior to posterior. Okay, we have to make this connection, right? So from side to side, and from anterior to posterior, and from anterior to posterior. Alright, so how does this work? How does this work? I'm going to use a different color here. Now, if we want to go from side to side, right, from side to side, let's see if I can use a different color, maybe. All right, let's try this one right here. Okay, now we go this way. Kind of a different color, right? I still see it the same way. Oh well, that's the connection between one side of the brain and another side of the brain, right? That will be one interhemispheric connection or crossover. And this one here, which is going to be number 7, we're going to call it the anterior communicating artery, right? Anterior communicating artery. Perfect. But now we have to connect the anterior circulation to the posterior one. And we're going to use this two right here. So number 8, one to the right, one to the left. Number 8, we're going to call it, and it makes sense, posterior communicating artery. Perfect. All right, so now let's make this looking a little bit better. All right, let's go this way. Looks a little bit better now, right? Looks a little bit better right here. Perfect. Now we have the circle, right? Now we have the circle. But I have to tell you something else. This anterior cerebral, remember number 3, anterior cerebral, has a segment 1 and it has a segment 2. Segment 1 right here, segment 2 right here. And this posterior cerebral, all right, has segment 1 and a segment 2. Segment 1 and segment 2. Remember, anterior cerebral artery is going to have segment 1, segment 2. Posterior cerebral artery is going to have segment 1, segment 2. All right. Now, the question is, which vessels are forming the circle of Willis, all right, at the end of the day? Which vessels are forming the circle of Willis at the end of the day? And look at this. Follow this line right here. That's the circle. That's the circle right here. So we're going to say number 1, internal carotid artery terminal, all right? Terminal ICA. Okay, we're going to say segment 1 from the anterior cerebral artery. Anterior cerebral artery segment 1. Also, we have what? The posterior communicating. Also, we have what? The anterior communicating. And what else? What else in here? Number 5, posterior cerebral artery segment 1. And just to be more precise in the names of these segments, we call this one A1, A2, all right? A1, A2. And we're going to call this one right here P1. And this one P2. Okay, just let's repeat this one more time. The circle of Willis is formed by all these arteries in here. Terminal internal carotid artery. Check. This one here. Anterior cerebral artery segment A1. Check. This one. Here. Posterior communicating arteries. Yes. Check. This one's right here. Anterior communicating artery. All right. We're going to check this one right here. And posterior cerebral artery segment P1. Check this one right here. And then we have the circle. And then we have the circle. Perfect. Beautiful. All right. That's a nice way to remember. Let's review this. When you see this, recording, just review it one more time until you learn all of this. All right, until you learn all of this, because this is going to be interesting, and this is the foundation to understand later what we call transcranial Doppler. What we call transcranial Doppler. All right, let's go back to my presentation right here, and let's take a look at this one. Okay, we have the terminal ICA right here. It ends at this point. It's coming this way. It ends at this point right here. And then, coming from the terminal ICA, we have what? The middle cerebral. Remember, it's not part of a circle of Willis. It's not part of a circle of Willis. And then we have the anterior cerebral with the segment A1, which is this one right here, and the segment A2, which is this one right here. Then we have the vertebral arteries, one here, which is going to give you the basilar. This one is a superior cerebellar artery, so we're not going to talk about this too, right? Let's forget about this too for now, all right? And then this basilar is going to give you what? Posterior cerebral with the segment P1. And then after this takeoff of the posterior communicating, we're going to call it segment P2. Before the takeoff or origin of the posterior cerebral, so we're going to have right here P1. After we're going to have P2. Now we want to make a connection, all right? Make a connection from one hemisphere to another that we'll call crossover, all right? Then we're going to use this right here, which is the anterior communicating artery, right? Just going to connect one side to another. And then if we want to make a connection between the anterior and posterior circulation, then we're going to use this posterior communicatants. Perfect. And one more time, so arteries forming the circle of Willis, we have number 1, terminal ICA, right here. Number 2, we're going to have segments A1 of both, all right, anterior cerebral arteries, right here, right here. Then we have the posterior communicatants, this one's right here, anterior communicating, this one right here, and segments P1 from both posterior cerebrals. So this and this, and that's the circle, all right? That's the circle. Now, something that you need to know, also something that you need to know is that one common anatomic variant of the circle of Willis, it has many of them, but one common is hypoplasia of the anterior cerebral artery. Let me repeat this one more time. Hypoplasia of the anterior cerebral artery. So this one, the anterior cerebral, this one right here, this one, may become like smaller, like underdeveloped, and this is what we call hypoplasia, or sometimes it's absent. So hypoplasia or absence of the anterior cerebral artery. That's a common variant for this circle of Willis. It's a common variant for this circle of Willis. All right, so here, arteries forming the circle, terminal ICA, check, we know this. Anterior cerebral artery, segment A1, check, we know this. Posterior communicating arteries, we have 2 of them, check, we know this. Posterior cerebral artery, segment P1, check, we know this. And anterior communicating artery, check, we know this. Beautiful. Now, this is a lecture, this is a shorter lecture because, you know, I want you to understand real good and perfect this anatomy, this intracranial anatomy, and this connection between the posterior and the anterior circulations. So in the next lecture, we're going to start going into this world of signs and symptoms and pathology. And this is where you're going to apply what you have learned in our lectures of hemodynamic, Doppler, and anatomy until now. So thank you for making it one more time, and I'll see you. We're gonna have a lot of fun, all right? So thank you for making it. See you next time.